Hello, good evening, everyone. This is Dr.
A hearty
Monika
good
Ghuliani.
evening. A hearty good evening to everyone, and welcome to our session on the topic of early pregnancy do's and don'ts with recognition of danger signs. We're pleased to have Dr. Monika Ghuliani among us to educate us and to shed some light on this beautiful topic. Doctor, you have the stage.
Okay. Yeah, good evening, everyone. Uh, I'm Dr. Monika Ghuliani, associated with Apollo Cradle Hospital, Nehru Place. So, I'm senior consultant in gynecology. So, today we are going to discuss a very, very important topic, which is about the early pregnancy, its do's and don'ts, and any early danger signs. So, we'll go one by one, symptom wise. So, first of all, how do we come to know that we are pregnant? So, once we the most common and most important symptom which tell us that we are pregnant is when we misses our period. So, when we misses our period, that means already the patient is 4 weeks pregnant. And how can we confirm that pregnancy? We can go for a very easy test which can be done at our home itself, and that is urine for pregnancy test. And if it is a very easy test, you all must be knowing about it. And if you want to confirm it in a better way, then we can go for the blood test also, which is known as beta hcg test. And third investigation which can tell us about the pregnancy is the ultrasound. But ultrasound can confirm our pregnancy in fifth week of pregnancy. But before that, we can only see the endometrial thickness. So most important and most common test done is urine for pregnancy test, which can be done at our home only. Second important symptoms, which we even see in our movies also, is nausea and vomiting, which is commonly known as morning sickness, which is actually a misnomer. Many patients, they suffer from this issue throughout the day. So it should be called as pregnancy sickness, not the morning sickness. And nowadays, so since people are working and so many safe medications are there, so it is important, if you are vomiting more than once a day, and if it is hampering in your daily day to day activities, you should consult a doctor, because all so many medication which are specially for pregnancy related nausea and vomiting are available, and doctor will advise you those. And in nausea and vomiting, in morning sickness, what is the danger sign? If you are vomiting with even a single sip of water, then it is known as hyperemesis gravidarum, and doctor may advise admission. So always follow the instruction of your doctor. And if the doctor is saying it is excess and it is definitely affecting your body, you should definitely get admitted. One more important symptoms, you may feel some common symptoms are like you may feel dizzy, you may feel headache, you may feel mood swings. They are all hormonal, so nothing to worry. And if you have mood swings, you should also be aware of those mood swings, and your family members should also know about your mood swings, that this is actually common in pregnancy. And if you are feeling very very depressed, then also you should seek a doctor's advice, because pregnant patients very rarely they may go in depression, and they may need some medication. And it is all hormonal. Once you are through with your pregnancy, most of the patients they recover, and no further medication is required. Another important symptoms, you may feel like, because of your breast is growing, you may feel engorgement, slight pinching, pain in your breast. That is also normal, because breast is growing from the very first day. Breast start growing to feed the baby, and milk formation starts. So that leads to increase in size of the breast, that may lead to tingling or pinching sensation in the breast. And even you can see some milk discharge coming through breast. So nothing to worry. Don't fondle with your breast, don't touch it again and again, because it may lead to uterine contractions, and that may be risky for the baby. So if you are, even if you are having milk discharge, don't panic. Just be calm. And one important thing, if you are lactating a baby and you becomes pregnant, then if you want to continue with the pregnancy, then stop lactating, because again the reason is the same. When the baby will suckle, then the uterine contractions may happen, that may lead to unwanted abortion. So it should be avoided. So always doctor, all the doctors, they advise to stop lactation if you are pregnant and you want to continue with the pregnancy. Okay. And now you can some more symptoms which are very normal in pregnancy, like excessive thirst. You can feel lightheadedness. You can feel sensation of excessive smell, which is known as hyperosmia, or you can feel distortion of the taste. Some food you may like earlier, but now you don't like, and some food they you may develop taste. So this is all normal. This is absolutely normal. So you can discuss with your doctor, but these all symptoms are definitely normal. So some changes you may notice in your skin. Some lucky people, they may develop glow in their skin, and some people they may develop acne, as well as they develop pigmentation in the skin. This is all hormonal. Everything is hormonal. So skin treatments are not at all advisable in pregnancy. Just ignore your acne as well as the pigmentation. Just focus on the baby. And uh, we can treat these skin problems post lactation. Even in lactation, we can't give you any medication. One more symptom which is very common is backache. Backache is very common. It is also again hormonal. A hormone name with a name relaxin. It gets released in the pregnancy to relax our all the cartilages, all the muscles, so that the delivery may happen naturally. So it is under effect of that hormone, that is relaxin, that we suffer from backache. So no need to do anything. Many patients, they definitely may suffer a bit more than the other people, but even then we'll go for the conservative management. We can do the hot fermentation and local application of any analgesia like Volini move, you must have heard of. Anything can be applied. And if it is radiating to your leg, one of the leg, then definitely you should seek an orthopedician consultation. That is important. Now one more symptom which is very very important is bleeding. You may have bleeding in your early pregnancy. So that may be dark red in color, that may be brownish, that may be pinkish. It may happen in initial days of your pregnancy. If it is in the form of spotting during 3-4 days of your pregnancy, that may be implantation bleeding, which is physiological. But I would advise you, even if you have a single spot of bleeding, once you are confirmed with the pregnancy, please take doctor's advice, because that may lead to unwanted abortions, and that may harm the baby also. So one should always go to doctor whenever you have bleeding. So definitely implantation bleeding may be there. It may be a sign of missed abortion. That means there is no fetal heart. If it is dark in color, it may lead to abortion, and which can be avoided. It may be the alarm for the threatened abortion. So one should be aware of these things. And one very very important thing which I want to tell you is, if it is accompanied with severe pain lower abdomen, and that is too on one side, either on right or left, and if you are feeling dizzy with that pain, immediately seek doctor's help, because that may be a ectopic pregnancy. That means pregnancy may be implanted outside the uterus. Though these scenarios are not very common, but even then we should take everything as alarming, because pregnancy, each and every pregnancy is precious, so we should always take care. And one more symptom is vaginal discharge. Vaginal discharge also changes a lot during our pregnancy. It becomes thick. It becomes it becomes very thick and increase in amount. If it is smelly, then you should take the doctor's advice, and even if it is itchy, then also you can take the doctor's advice. They'll give you pessaries. If it is smelly, they'll definitely treat. That means you have bacterial infection, they'll treat on those lines. So you should inform your doctor the type of discharge which you are suffering from. One more very very important symptom is frequency of micturition. Frequency of micturition means you are going to pee again and again. If you are going to pee again and again, that may be a normal symptom. A normal symptom in pregnancy, because uterus is lying just behind the bladder. So as the uterus is growing, bladder capacity decreases. So we actually receives fullness alarm for our fullness of bladder very early when we are pregnant, and because the uterus is increasing in size and both are pelvic organs. So the uterus may press on the bladder and we may get alarm for going to pee. So it may be a physiological thing also, but if you are going to pass urine again and again during night also, more than twice, then definitely you should get your urine routine done, your culture done, as well as consult your doctor. And if the color is dark, you are feeling burning, so it is alarming and you should take care of this thing. You should definitely tell your doctor. So there may be hot flushes also, like small some amount of postmenopausal symptoms also we suffer from during our pregnancy. So we may feel excessive thirst. We feel like taking a lot of, again and again taking a lot of water. That is absolutely normal, and that it is actually helpful for our baby also. There may be increase in temperature. There is actually always increase in temperature during pregnancy. It becomes approximately 99 degree, and it is physiological. At 99 degrees celsius, there is no need 99 degree fahrenheit, there is no need to take any medication. But if fever exceeds 99, then definitely you should inform your doctor and take the advice. And most important thing is, whenever you confirm the pregnancy, as early as you confirm the pregnancy, go to the doctor. Even in the if you are planning for pregnancy, one visit to the doctor is mandatory, that because they will start with the important medication, that is folic acid, which is very very important for the brain development of the baby. And it may prevent so many uh, uh, so many things which are actually avoidable, like neural tube defects, brain defects. These can be avoided with folic acid if we start them preconceptionally. So even preconception, you may go, and some basic tests are also done if you go before planning your pregnancy, like thyroid and how much hemoglobin is there. So these things are important to be taken care of. And if you are deficient in hemoglobin, or there is any discrepancy in thyroid hormone, then definitely doctor will start, and the baby which will come in your womb will be healthy. So these are important things to be taken care of. And even if you haven't gone to the doctor during preconceptional period, once you confirm the pregnancy, immediately consult a doctor so that they can start the folic acid. Never ever self medicate yourself, because most of the drugs are harmful for the baby. They may cause unwanted birth defects and may lead to abortions also. So always take medication which are advised by the gynecologist. Never ever self medicate also. Now you can do some light exercises, yoga. Never do any sternus exercises. if you have joined the gym, then stop going to the gym, or you can just ask your trainer to do some light exercises. And light, when to stop your exercise: if you are feeling headache, or if you are having like faint, you are feeling like you will faint, anything like that, if you are feeling nauseous, then you should stop exercise immediately. Okay, then take plenty of fluid, rehydrate yourself, and then you can do these things. So in pregnancy we also suffer from low blood pressure. It is because of the vasodilatation to supply more blood to the baby, so our vessels dilate, so we suffer from low blood pressure. So many a times you must have heard or seen, so pregnant patient, they feel like fainting, they feel like dizzy. So they can have plenty of fluids, that too mixed with salt, and that is very very helpful. And uh, they can have coffee also, but in limited amount only. We can only 200 milligram of caffeine is permissible in a day. That means 1.5 cup of coffee or 2 cups of tea, that's it, not more than that, because it is not, it is quite harmful. So though it is not proven, but even then we tell to avoid. So what is to be avoided in pregnancy: no alcohol, no smoking, and drugs, no self medication, no strenuous exercises, no physical relationship, and avoid pineapple, papaya, and Chinese food which contains ajinomoto. Even Maggie has ajinomoto, so one should avoid as much as possible. So for taste, you can have a small amount, but momos and Chinese food one should always avoid. And no bed rest is required. You can do normal exercises, as I have told you. When to stop also I have told you. So yoga you can do, gentle exercises you can do, and that's it. Thank you so much for your patient listening. Any questions?
If there are any questions, you can feel free to put your questions in the comment section. We will get back to you. Any questions at all? Now, I guess there are no questions at this point of time.
Okay, one thing
So,
I want to tell you, one thing I forgot to tell you: if you have pets, then please handle their litter with the gloves, with your gloves on. Never ever handle their litter while you are pregnant, especially in first 3 months. Always handle their litter with your gloves on, because that is very very important, because they may contain such bacteria which are harmful for us and our baby. So this is a very important thing, because nowadays so many people they actually have pets. I feel breathless. What to do? Okay, dear. So you may be suffering from acidity. So that is a very very common reason with that patient feel breathless. So you can have some safe antacid like Rentec, or you can have any syrup 3 to 4 TSF whenever you feel breathless, or you can definitely go to your doctor and get your heart checked. So most probably there will not be any issue, only the acidity. It is very very common to feel breathless whenever we have acidity. So it is because we have, that's why we have nausea and vomiting. So some people, they don't have that much of nausea and vomiting, but they feel breathless and they feel like discomfort in the chest, and they feel burning sensation. So we can have syrups like Gelusil or Mucane gel, which have local anesthetic effect, and we feel better, and we feel we start taking normal breaths. Any other question? You're welcome, dear.
Okay, doctor, I don't think there are any more questions. If there are any more questions, we will get back to our audience to the comment section down below.
Sure,
Thank
sure.
you so much for such an informative session, and it was a pleasure learning such brilliant things. Oh, we have another question.
Yeah, yeah, sure. Yes, dear. Antibiotics are Some antibiotics are safe in pregnancy for UTI. Definitely, we have antibiotics for in pregnancy for UTI, and some antibiotics, especially, they work only on urine, so you can take those. Your doctor must be knowing. 2 3 antibiotics are there, though they are limited, but once you get your culture done, they'll give the list, and out of that list we can definitely sort out whichever is safe in pregnancy. We can give that one, and it is sorted out. UTI is very, very important to get treated in pregnancy, because it is harmful in each and every trimester. In first trimester it may lead to abortion, second trimester it may lead to preterm labor pains, and third trimester it may again lead to leaking, preterm leaking, and IUGR also. It is very, very harmful, and each and every person should be aware of this thing. And because the most common cause of preterm pregnancies, in my view, because I have been practicing since last 18 20 years, so I've seen so many patients with UTI landing up with like preterm and everything, so it is to be taken care of. Any other question? How many C sections are possible? Actually, in India, we are restricted to three, but in some scenarios even we have done fourth one, fifth one, but these are rare cases. But in like Arabian countries, they even they do 8 cesarean sections, 9 cesarean section, but definitely that is very, very risky, very, very risky, because there are chances, again and again you are cutting the same thing and you are resuturing it, it becomes very weak, so chances of uterine rupture increases the more you do cesarean section. So it is not advisable to do more than three, definitely. No, not advisable. One should go for like ligation once you are done with the third cesarean section. One should advise, the doctor should advise, and the patient should follow. No more than three. In some very precious scenarios, definitely we can do fourth one, but that to be monitored throughout very aggressively. Any other question?
Okay, doctor. I guess in this case, since we have no more questions, I guess we can wind up the session for the day. Thank you so much. It was a very informative session, and I'm pretty sure everybody learned a lot as well. Thank you,
Thank you
everybody, for
so much.
coming, and hope to see you soon.
Okay, thank you. Bye bye. Good day.
Good day, everyone.
Good day, everyone.